Hypertension is often there in renal failure. Is this hypertension producing renal failure or is renal failure causing hypertension? Is a common clinical dilemma. So, did the BP damage the kidney or is the kidney the cause for the rise in BP? Because there is pathophysiological difference. If hypertension produces renal failure, it is primarily a vascular disease. Long-standing high BP causes hyaline arteriosclerosis, nephron ischemia, and a gradual GFR reduction. Kidney is the victim here and hypertension is the villain here. Compare this to primary renal failure producing hypertension. Here, primarily it is a renal disease. Kidney dysfunction leads on to sodium retention, volume expansion, RAS activation, and hypertension. So, kidney becomes the driver here. In the former, hypertension was the villain. In the latter, kidney is the villain. The clinical clues is that when hypertension leads on to CKD, it's usually long-standing, while when CKD leads on to hypertension, it's a short history. The onset would be rapid in that. BP severity is mild to moderate in hypertension CKD, while it's severe and resistant in the other way. Urine is bland in hypertension CKD, while active sediments are seen in CKD with hypertension. Fundus shows hypertensive changes in hypertension with CKD, while it is minimal in CKD with hypertension. So let's see some real-world examples. Patient with 10 years of hypertension, gradual creatinine rise, minimal proteinuria, and urine doesn't show any active sediments and is bland. It is likely hypertensive nephrosclerosis. Compared to another patient who has a sudden severe hypertension of a few months or few weeks with hematuria, proteinuria, likely it is a renal parenchymal disease, mostly a chronic glomerulonephritis producing secondary hypertension. The imaging clue is that hypertensive damage usually has a bilateral small kidney, while in a primary renal disease, the kidneys usually show symmetry and preserved size early. But later on CKD, it can have contracted kidney. Now, the teaching pearl is that when you have urine, active sediments, the kidney started the problem. When you have urine that is bland, BP likely did it.